Shall we start the program? Good morning to all. I invite K. Valarbandi ma'am, Assistant Professor of English, to deliver welcome address.
Thank you, Kartika, for your technical support. Okay. Good morning to all. Good morning, ma'am. A pleasant morning to you all. I am extremely delighted to welcome you all to the national webinar on physical activity, immunity, and COVID 19, organized by Women Empowerment Cell, Saraswati Narayan College, Madurai, Tamil Nadu. It gives me immense pleasure to welcome the resource person, Dr. P. Hemalatha ma'am, BPT, CLE, CLFN, Women's Wellness Consultant in Ayush Center for Women and Baby Health. She completed her undergraduation in Dr. MGR Medical College in 2018 and completed certification in lactation education and counseling from University of San Diego, USA. Founder of Ayush Center for Women and Baby Health. Given presentation on women and baby health at various hospital and education institutions along with her successful clinical practice. She is a well-wisher of her institution for giving lectures of our girl student. We are extremely grateful to you, ma'am, for consenting to be the resource person of today's webinar. We submit our indebted welcome to our principal, vice principal, and fellow teachers for their support and guidance. Above all, we are glad to welcome our dear participants who have made this webinar more meaningful. Now I call upon Dr. Hemalatha ma'am to deliver her address. Welcome, ma'am.
Welcome. Thank you. Good morning to all. I'm glad to be here to present this topic that too in this pandemic situation. My heartfelt thanks to Dr. Kannan sir, Principal of Saraswati Narayanan College, and Vice Principal sir, Dr. Krishnan sir, for giving me this wonderful opportunity to present this topic in this forum. I render my special thanks to Mrs. Valarmati ma'am and Dr. Minimala ma'am for inviting me to present this topic here. So, the COVID pandemic 19 is an unparalleled time all over the world. Worldwide social distancing are put up, and people are restricted to do their daily activities. Governments asking people to stay home and stay safe. This, of course, means that people spend most of their time at home. So, social distancing measures mean that people have far less opportunities to be physically active, especially if cycling and walking as transportation and other activities such as walking and jogging, going to gym are being restricted. So, added to these, because of these measures, it makes people so much sedentary for a longer period at home. So the impact of physical activity, that is inactivity, may likely seen in health, social care, and social care and mental well-being of people globally. So not only in our country, it is seen in all over the world. Although these social distancing are measured as an important and needed of the time as of now, our bodies and mind need physical activity. So, what is mean by sedentary lifestyle? So, we are forced to attain sedentary lifestyle nowadays because of this pandemic situation, right? So, everyone is sitting in front of the system or laptop or using gadgets and sitting for too many hours and spending our most of the time in sitting. This is what's said to be sedentary life. So, sedentary life is very bad for health. Now, by this time, everyone must have known that sedentary life is highly dangerous and hazardous. So, everybody will be surfing the net and will go on searching what happens to us if we go on sitting for a long and long hours of sitting. So, in this topic, we are going to know about how physical activity is going to help you to come out from this sedentary lifestyle and how physical activity is going to boost your immunity or suppress your immunity. Wondering how immunity is going to suppress through physical activity? Let's wait and see. Then, how you can stay happy and stay away from stress with the help of physical activity. So sedentary lifestyle is nothing but sitting for too much of time. That is sitting for hours and hours together without moving our body. So everyone must be knowing that sitting is more injurious than any other disease in the world. So they are comparing with smoking, like it is more injurious than smoking. Sitting is the major reason for all other diseases like diabetes mellitus, BP, that is blood pressure, then cardiovascular accident, CVA or CVS, cardiovascular disease, that is stroke. Then comes about then comes pain management. You get all sort of pain in this sedentary lifestyle, starting from neck to ankle. So because of sitting. Then comes hip pathology. People often develop OA hip, that is osteoarthritis of hip, because of this sedentary lifestyle. And important thing, stress. So stress plays an key role because of this sedentary lifestyle. So studies have shown that sedentary behavior has led to depressive feelings and low moods in healthy people within 7 days. So people, please make a note, within 7 days a normal healthy individual are getting depressed because of this sedentary lifestyle. So I asked everyone to come out from this and to lead a happy and healthy life. Shall we get into the PPT? Mrs. Katia, can you share me the PPT screen? Kartika? Kartika? So this is about me. I'm Hemalatha, basically a physiotherapist and also lactation counselor. I completed my graduation and Dr. MGR Medical University and CLEC in University of San Diego, California. And I work as a women's wellness consultant in my very own clinic under the name of Ayush Center for Women and Baby Health, and also at Anand Elumalai Hospital, Madurai. This is a brief introduction about me. Next. So, first, let us know what are the different types of physical activities available. So, everyone thinks that physical activities is only exercise and yoga. No, let's see what are different types of physical activities. Next. So walking is one of the best, easiest physical activity, which is advisable for all ages. So from the children's, it can they can start walking to geriatric patients. Even old age patients can go for walking. But in this pandemic situation, you cannot go for walking, but you can walk within your home. So you cannot. It is not necessary to stop your walking regimen because of this pandemic issue. You can go ahead, but go for a walking within your house. Then here comes a jogging. So jogging is also a physical activity. It is also one of the aerobic activities which helps you to stay fit and healthy. Next, yoga. So yoga is not only for physical health, it is also for mind relaxation. So yoga is highly connected with body and mind. So it is one of the best exercise for both mind and body relaxation. Swimming, best cardio workout. But unfortunately, it is not possible now because of this, because we cannot go out and practice swimming. It is not safer to. So once the situation gets calmed down, you can start going for swimming, which helps in lots and lots of ways to help your conditions to maintain, and you can control your blood pressure, diabetes mellitus, your endurance can be maintained, everything. So swimming plays a major role in cardiac workout. Next, next, dance. It is one of the easiest thing. Everyone loves to dance. So physical activity is nothing but moving your body. So it may be either through exercise or yoga or through swimming or walking, jogging or some pilates or core strengthening workout, etc. But dancing gives us pleasure. As we all know, we all love to dance. So even in dance, you get more of happy hormones released. So keep dancing. This is also one of the physical activity. You need not worry that I didn't do exercise today and I didn't go for walk today, and you don't feel guilty. Just play music, go in your room, lock the door, and do whatever the movement you like. But be cautious that you should not strain yourself. Play whatever you love, play the song whatever you like, and keep moving your head, neck, shoulders, all the body parts. Then you are doing a physical activity at least for 30 minutes. This is one of the best exercise for mind relaxation too. I'm sure you will really enjoy if you try this. Have a try and experience the joy of happiness. Next, impact of physical inactivity. So here comes the main part. So what happens if you don't do exercise regularly? That is, if you don't do physical activity regularly. So let's say you have seen many of them have known by this time all the things like you will get sugar, like diabetes mellitus, will get blood pressure, etc. But one should know how it is affecting. So let's see. Next, diabetes mellitus. So this condition, diabetes mellitus, is nothing but increased in blood glucose level in your body. So, can you see the people how they are spending their time? See, all the four persons are sitting continuously and they are enjoying like anything. They're too having junk foods among them. So just think how the situation will be. You can see at the corner, like a healthy individual have normal production of insulin, which helps the body, which helps the body, that is, which helps glucose to get absorbed in the cells, thereby we get energy. So what happens in type 1 and type 2 diabetes mellitus? There are two types of diabetes mellitus. Everyone must know this. Not everyone will have same type of diabetes mellitus. Type 1 and type 2 are entirely different. And one more is also there, that is gestational diabetes, which comes during pregnancy and it may go off once the baby gets delivered. So first let us discuss about this two type of diabetes mellitus. In type 1 diabetes mellitus, it is also known as juvenile diabetes mellitus. That is, it can be diagnosed in the childhood. So it comes from the childhood. So these are all more of genetic dependency. But still, you can maintain healthy life through proper dieting and proper physical activity. See what happens here? The pancreas is in your abdominal cavity, which fails to produce insulin. So insulin is highly needed for your body to allow the glucose to enter into the cell. So only you get energy if glucose are entered into the cell. Unless glucose enter into the cell, you will not get energy or stamina. That's why you can see diabetic patients are more prone for tiredness. They feel exhausted often because of this. Coming to type 2 diabetes mellitus, it is more of like what insulin production is there, but insulin resistance is also there. That is, the insulin production is very less and the receptor cannot accept the insulin, so that glucose is not entering into the cell. So thereby we are getting diabetes mellitus and we are getting tired or exhaustion easily. So this is because of, mainly because of poor dieting and lack of physical activity. So once you start doing activity, your internal abdominal organs are also get exercised and pancreas will produce insulin, and this insulin resistance will decrease and thereby glucose enter into the cell so that you get energy. So this is how physical activity helps to stay away from diabetes mellitus. Once you have diabetes mellitus, you can still maintain a healthy life. So like you can maintain your blood sugar level through physical activity, but keep it in mind that if you are more prone for low sugar often, always consult with your therapist regarding exercise protocol. So like your mode of exercise should not be intensively high or moderate. It should be very mild to moderate, not moderate to high intensity. It should be very mild to moderate. And check your glucose level before doing exercise and after doing exercise, so that you are not going into low sugar, and have your water bottle or juices along with you, so that you can have a sip of juice or water in between doing your exercises, so that you don't feel exhausted. So this is the basic thing how physical activity can help you. So everyone knows like oh, you are not doing physical activity, then you will get diabetes mellitus. But you should know what happens in your body and how physical activity plays an important role in maintaining your blood glucose level. So you can dance, that also helpful in maintaining the blood glucose level. So keep moving your body parts, keep walking, that will help you a lot. Next, so ankle pain, we can see the slide later. It will come along the pain management. Next, pain. So again, pain because of poor posture. What all will do, once they are into the laptop, they will stop slouching like this, and they will keep on using their fingers, wrist in flexed position. So they will get all type of pain. That is sorry, that is starting from neck. Even it starts from eye muscles, and it goes on travels like this to the head, neck, shoulders, upper back, low back, then to the hips, knees, and even to the ankle. That's what I have mentioned the picture separately. Ankle pain. Everyone must be wondering how sitting will cause my ankle to get pain. It will cause pain because of poor posture, and most of them will not have foot support, so they will just hang their foot like this without support. So what happens, the lymphatic drainage will not be proper, and the backflow of blood is also not proper. So the ankle get edematous, that is collection of fluid, and that may cause soft tissues problem, thereby ankle may get pain. Then regarding poor posture, once you are doing, you are seeing or you are using mobile in poor posture, like this stooped posture, what happens, your neck extends as muscles and flexors muscles get contracted, and one set of muscle goes for overstretching. So we'll end up with pain. Because of neck pain, you have drooped posture. Like you will have high shoulder and kyphosed back. So you will get shoulder pain and upper back pain also. Then coming from upper back pain, you will get from because of that upper back pain, lower back is also affected. So please take care that you should sit in the proper position and using the laptop in the proper position. Like you should have hand rest so that your wrist is not flexed. If your wrist is in flexed position, you get wrist pain very often. At one certain point, you cannot move the wrist at all. So please be careful. You can have a smiley ball and you can press in between your work, like with even like between uh, 1 hour or 2 hours once, you can just press the smiley ball, or else just you can squeeze the fingers and just relax and rotate your wrist and do it in anti-clockwise. These are all simple exercises that you can do it in sitting itself, which helps a lot to get relief from your pain. Once you try this, you will know how it helps. Okay. Then normal bone will be in high density. You can see the thickness in both the bone. See, in the normal bone, we have high density. That is, the bone thickness is large. Whereas in osteoporotic bone, see, there is no thickness, that's no density at all. So the bone is very fragile, fragile in the sense weak. So the chances or fractures are more here. So in order to have a healthy bone, one must do physical activity. So during physical activity, all the weight transmission is transmitted through the bone. So only through weight transmission we can get a good bone density. So without this, you are more chance for getting osteoporosis and osteoarthritis. Everything will come in earlier age. For example, if older generations are getting pain by 60 years of age, now people are getting by 30, even in 20s, because of this sedentary lifestyle. Okay, next. So as I said, you can see here. So the bones are very fragile. So even a mild slip can cause fracture. So please be cautious. Then next, obesity. So, in the olden days or days before COVID, what we do usually, we go and have lunch or dinner or a breakfast by spending time for that particularly. But nowadays we don't have time at all because we have a call from office. We will have a call from other colleagues during work time. We don't find time to eat at all. So what we will do, without our conscious, we will seek for a junk food, that is which can be eaten very easily and which is very comfortable while doing work. So automatically we become obese, and we have invited cholesterol by eating this type of junk foods. So this has to be avoided. Spend time for your breakfast, lunch, and dinner. During your food time, please go for cross-leg sitting in the floor, not on the bed or couch or chair. Go for floor sitting. This will help you to prevent osteoarthritis on knee and hip. You won't believe, we see lot of patients aged 20, even in school. Children's, they are unable to fold their legs because our school education system has given, like, they are sitting in a chair and desk, and after coming to home, they are again sitting chair and desk for writing their homework, and again dinner in the chair itself, and then they go for lying. There is no physical activity, there is no stretching of back and your hip muscles. So this is not advisable. I request every mother and every parents to do this activity along with their child. At least have your food time in cross leg sitting and the floor, and see the difference. Many of you cannot sit on the floor. I am damn sure about it because no one is following the olden method. So please give a try and change your lifestyle too. Next, as I said, hot. So, our important thing, without physical activity, heart will not function properly. Your arteries will get thickened, so blood flow is limited. Thereby, blood to the heart is limited, and because of that limited flow of blood, your total body gets deoxygenated, and in one particular period, heart fails to pump. There comes myocardial infarction, that is heart attack. So cardiac issues are more common in sedentary lifestyle. So people, please be aware of physical activity in your life. Everyone should do some sort of movements to stay away from these type of diseases. Next, diabetes we have discussed already. Next, deep vein thrombosis. Um, Deep vein thrombosis. Have you ever heard this term deep vein thrombosis? Other than medical professional, other people will be hearing less much of this type of thing like deep vein thrombosis. So it is nothing but a thrombosis, that is a clot formation in your cuff muscle. We have two hearts in our body. Anybody aware of it? So one is, it's in our rib cage, and the other is our cough muscle. So cough muscle is considered to be the peripheral heart of the body. So it is easy for the heart to deliver the blood towards the gravity. That is, it can goes towards the leg with the help of gravity. But the blood has to go up, that is against the gravity. For that activity, your cough muscle strengthening is very much important. So if you fail to improve your cough muscle strengthening, then your circulation will be very poor. If you are not moving your limb for more than 24 hours, or if you are in a sedentary sitting position or lying position for more than hours and hours, like more than 6 or 7 hours, you may get a chance of getting deep vein thrombosis. People might have known who are traveling in air. There, the air hostess request request us to have a walk in between the hours, in between 2 hours or in the 2 hours once. This is because to prevent deep vein thrombosis, because it is such a severe condition which may put you to fatal. Like if a clot is formed, then it may travel up and it can reach the lungs or heart, which ends up in cardiac issue or pulmonary issue. So once deep vein thrombosis has started to come, it is better to stop exercise. That can be identified easily, like cough pain, if you have discomfort, if you have swelling around the cough muscle area, if you have any sort of ulcer or a rashes, please check it with doctor. You may need anticoagulant therapy, and stopping is also essential in order to equalize the pressure along your leg. So to prevent deep vein thrombosis, you can keep move on your ankle and toe, like doing tailoring exercise, like doing forward and backward movement. You may think this is a very simple exercise, but it does a lot. It means a lot to us. So the just consider this is a peripheral heart. So to safeguard this peripheral heart, our ankle toe movements and cough stretching plays an important role. So this is about deep vein thrombosis. Everyone must know about it. This is different from varicose vein. So one must not confuse with varicose veins and deep vein thrombosis. Deep vein thrombosis comes in such cases where the limbs are not moved, whereas varicose vein comes where the veins are put under stress for a long time. So it is common in persons who are standing for a long time. I'm telling about varicose vein. But in deep vein thrombosis, where the people are not moving their legs often, and so thereby they are getting clot, and that clot gets traveled to the upper body, and it reaches a pulmonary, that is lungs or heart, and there comes a fatal disease. So please be aware of deep vein thrombosis too. Next, I. So in this webinar itself, you can see more of us are peeping into the screen like this. So please don't be like this. Sit erect, relax your eye muscles. Because of this situation, we are in online oftenly. Like I may consider me like I am taking classes online, and I sit for online classes for my child, and again I use laptop for some other sort of help. So everybody is using system and gadgets continuously. So what happens to our eye muscles? Our vision is affected, fluid discharge happens, and many of them have lost their vision. It is bitterly true. Everyone must know this, especially the children are very much affected because of using these gadgets. So how can you help them to get away from this? You can just ask the children once they finish the online class, you can ask them to do eye exercise along with you. Just close your eyes tightly and open your eyes. Just close your eyes tightly, hold it for. I request everyone to do so that you will not forget. It's a simple exercise. You can find it on internet, but you should know the reason how it works. That's why I'm asking everyone to do, and to make the session lively. I'm asking everyone to do so that you will be actively participated in this session and make use of it. It's your body. You are going to rejuvenate it now. So just close your eyes tightly and open it. Do it for 5 times. Then you can move your eyeballs towards the left corner and bring it to right side down. Move the eyes towards the left corner up and right side down. Don't move your head like this. This is not eye exercise. Just move your eyeball. Just move your eyeball up and cross. And do it on the repeat it on the other side. Up, down. So this is what eye exercise. Many will do like so. This is not at all the eye exercise. Then you can include like going up, seeing up, and coming down. This is also an eye exercise. This can be done. Then you can cleanse your eyes weekly once with clean water. You can soak your eyes in the clean water and blink it so that your dust will come out and wipe it with a clean towel. So this is one of the best cleansing method to clean your eyes. So make sure that you are doing properly. That water should be clean. Make a note of it. So you can do this, and you can start focusing on some objects, like you can sit erect and you can place uh, something, some point or some picture on the wall. Keep that 10 to 10-meter distance away from the screen and keep focusing on that at least for a minute. So this gives you a lot of energy to your muscles. This prevents darkness around dark circle around eyes, because of gadget user everyone is getting dark circles nowadays. Even childrens are getting it. Is very pathetic to see our childrens with dark circled eyes. So please encourage childrens to do this eye exercise daily. This is very simple. I ask parents to do first, then followed by children. Once you start to do, then children will start to do. Since you are at home now, you can actively engage your children by doing this. So we cannot force them to do, but once you start to do, they will automatically do by seeing yourself. So start a change from you. Next, constipation files. So you will be wondering like how sedentary life is going to be ending in constipation. So in constant sitting, all your digestive organs are not internal organs are not working, which makes the stool becomes hardened, and it is very tough for us to release stool because of the hardened stool. So what happens in this sedentary lifestyle? If we do some physical activity, we feel thirsty, so we will drink enormous amount of water. That's adequate amount of water. But we are lagging in physical activity. Then how we will feel thirsty? Some I can see, I know many of my friends working in IT, they will have a reminder to drink water. See how pathetic it is. For drinking water, we are setting a reminder like for within 1 hour I should finish this amount, and with this within today I have to finish this amount of water. So it is very pathetic to hear such situations. So please be active. So unless your water intake is not an enormous or adequate, your stool is going to become tight. Then you will end up with constipation or piles, and due to poor eating habits, there are more chance of intestinal cancer, rectal cancer, everything. So please be cautious. Next. So as I said earlier, sitting is a new smoking. So sitting is a new smoking. It is more dangerous than passive smoking too. Hope everyone must know what is mean by passive smoking. That is, you're not smoking, but you're standing nearer to the smoker. Then you are the passive smoker. You are getting more chance of lung infection. Stay away from smoker. Sitting is the new smoking I have given here, but it is more dangerous than smoking. So people, please get started doing a physical activity from today. Next, stress. Can you see how the lady is in stress? As of now, everyone is facing this situation. Even me, even our children's, it starts from our kids. So we are put into that much stress because of this situation, like emotional crisis, financial crisis, social economic status crisis, everything. For in everything there is a crisis, so we automatically become anxiety, stress, and due to sedentary lifestyle also our hormones are not happy hormones are not released, so we are put into stress. During stress time, you know, the hormones, the sad hormones, that is that the hormones which makes you to work fast, that is heart, which makes you to be alert and makes your heartbeat to pounds faster, will release enormously, will release largely. So what happens, you know, your heartbeat like increase like anything. We say we will tell like tachycardia, that is increase in heart rate. You'll be very nervous. You cannot focus on things. You'll be highly alert, but you cannot focus on things. Finally, you end up in depression. So what happens if you do physical activity? You know, in physical activity, happy hormones are released and stress level is decreased. You can experience it once you start to do. Next, stress. What happens when you sit for too long? We have seen so many things. What happens when you sit for too long? So can you see the picture? The devil is killing you behind it. Can you? So this is what happening for you all, for us all, not for you, for us all. So please change your lifestyle. Then next. So what happens? This is benefits of doing physical activity, and what happens if you don't do physical activity? As I said, if you have already symptoms of blood pressure, cholesterol, and other sort of disease, diabetes mellitus, pain sort of disease, all is going to increase. Finally, mental stress is going to increase. What happens if you do physical activity? You are maintaining your condition. That is, you are maintaining your present condition. You are going safely. Your cardiovascular risk profile is maintained. Then you are functionally active. So if you are physically active, you will be functionally active. You will be always ready to learn something new. So your mind and body will be fresh and always. Then automatically your mental distress will come down. Overall, you will get improved quality of life. This is how we can gain our life better. Okay. Then next. Next. So instead of looking into problems, we can look into solutions. Let's start. Next. So these are all simple stretches. You can do it in your sitting place. Just hold your hands and stretch it like this. Hold it for 5 to 10 seconds and relax yourself. Do it for 2 times, every 2 hours once. And you can take your extended or stretched hand over the head, and you can maintain this position for hold every stretching position for minimum 10 to 15 seconds. So I have given few pictures. Please try to follow it so that you can your muscle will not get tired. Next, these are all basic stretches. Get out from your chair and do these type of simple stretches, because in long sitting your thigh muscles are going to get shortened. This is the best way to stretch your quads, front thigh muscles. Next, this is for hamstring stretch. You can do it. Hamstring is one of the culprit for back pain. So please stretch your hamstring whenever you get time. Next, cough stretching. As I said you earlier, cough is the peripheral heart of our body. So it is essential to focus on cough. So active cough stretching will help you to pump the blood away from the gravity, that is towards the heart. Next, ankle toe movements. This also helps in maintaining your maintaining your blood circulation, and also ankle foot related problems. Next, this is for back pain. Those who are sitting in system, sitting in front of computer for prolonged time. They are in slouch posture, so that they can try this spinal extension exercise. If you have already a back issue, then consult with your therapist. Then next, pelvic bridging. It is one of the best exercise for core strengthening. It is also a best exercise for back pain too. Next, this is also a pelvic rotation exercise. It is also good for your hip and your back. Cat and camel exercise. If you don't have any back issues, we can try these exercise, which helps in bringing down your pain. That is, if you have any sort of severe disc prolapse, then you should consult with your therapist before performing these type of exercise, or else any all can do this exercise. Next, so coming to women's health, can you roll this slide? This is Kartika. Women's health, women's well-being. Next, 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 next. No, women's well-being. Okay, back to the slide. Okay, so women are facing more problems in this pandemic situation. So I'm here to tell more about women now. So women, I salute all the women because they are doing a great job now, because they are taking care of the family and also their work. So they are put into more stress. So in such cases, if they have urinary incontinence problem earlier, then they may get increased. So their dribbling of urine is often because of stress. So please do concentrate on how to get relief from stress. Then other next, then the other thing is from young girls, that is from the puberty. There comes, this is what weak pelvic floor muscles. So because of stress, we will get one can get urine dribbling whenever they cough, sneeze, or do something. So please get concentrated on pelvic floor muscles too. Seek a therapist for how to do pelvic floor exercise. Next. So PCOS. So every woman will know this. Everybody is facing this disease because of this sedentary lifestyle. PCOS is increasing a lot. So how one can be free from PCOS? They have to go for lifestyle modification, and they have to keep doing exercise regularly. They have to eat healthy and balanced food, and they have to stay away from white sugar. So once you stop eating white sugar, you can get the very good results of it. So most of the women are facing PCOS because of stress, because of lack of physical activity. I request every woman to do some sort of physical activity daily. Next. So this is how effect of exercise on immune system. Do you wonder how exercise will help to suppress your immune system? Let me tell. So just think, if you are sedentary, like you are in sitting position, what happens to your immunity? Immunity will go down for sure. If you are doing mild to moderate exercise, then it helps the white blood cells to fight against the bacteria or foreign invaders and keep your immune system up. But what happens if you do high intensity of exercise? You develop upper respiratory tract infection like wheezing, cold, etc. That's why you're not advised to do high intensity exercise. If you take athlete or a sports player, they are doing a high intensity exercise, but they are constantly monitoring their health. Like if they falls on any sick, like if they have any symptoms like insomnia, that is loss of sleep, or they feel overtiring, or they feel cold often, they will just consult with their doctors and also their therapist and their coach and modulate their exercise accordingly. One should not do intensive training without the help of a trained person. So please keep it in mind. Intensive exercise will not help you to get down your weight. Instead, it may develop upper respiratory tract down infection. So in sedentary lifestyle, something is better than nothing. In over, that is high intensity exercise, what to say? Something is better than nothing here. Too much of anything is good for health. Not good for too much of anything is not good for health. So consider this before starting exercise. Then next, so benefits of exercise, it helps to improve your memory. Just try this. Just have a dance for 15 minutes and relax yourself. Then sit in front of your system or study something. You will get more learning skills, etc. Just try it and give a try. So for women, I would say this is happy hormones. These are released when you are happy. So particularly when you are doing exercises. So what are the next hormones released? You can see this happy hormones. See how happily they are. Dopamine, serotonin, oxytocin, and endorphin. Each one has different role. One will help to lower your mood swing, and one will help you to to move away from stress, and one will help you to lower down the pain level, and one will helps you optimistic. So every hormones play an important role in making you happy. To make that happy hormones to release successfully, we need physical activity. So one must be happy by doing physical activity. So they can be happy by doing physical activity. So for women, I say self love. First, try self love. Do try a self love. So self love na என்ன உங்களை நீங்களே லவ் பண்ணணும். யாரும் லவ் பண்ணலன்னா பரவாயில்ல, ஹஸ்பண்ட் பண்ணலனாலும் பரவாயில்ல, குழந்தை பண்ணலனாலும் பரவாயில்ல, அம்மா அப்பா பண்ணலனாலும் பரவாயில்ல. You love yourself. You say like, I'm strong, I'm healthy, I'm beautiful, I can, I'm perfect. ஸோ உங்களுக்குள்ள நீங்களா பாசிட்டிவ் அஃபர்மேஷன் வச்சுக்கிட்டாதான் உங்களுக்கு அந்த செல்ஃப் லவ் வரும். ஸோ நோ ஒன் கேன் டிஃபிட் யூ அதர் தேன் யூ அப்படின்னு தான் சொல்லுவாங்க. நிறைய புக்ஸ் எல்லாம் நீங்கள் படிச்சிருப்பீங்க. இப்போ செல்ஃப் லவ் பற்றி நிறைய நிறைய நாவல்ஸ் புக்ஸ்லலாம் வந்து படிக்கணும். பிகாஸ் இந்த மாதிரி சுச்சுவேஷனில் வந்து எவ்ரி விமென் ஆர் புட் அண்டர் ஸ்ட்ரெஸ். நிறைய சூசைட் கேசஸ் எல்லாமே இன்க்ரீஸ் ஆகுது. ஸோ டு அவாய்ட் தட், டேக் அ டைம் ஃபார் யூ டு லவ் யுவர் செல்ஃப். ஸோ உங்களை நீங்களே லவ் பண்ணுங்க. நீங்கள் தான் பெஸ்ட், நீங்கள் தான் நல்லா பண்ணுறீங்க, எல்லாமே பாசிட்டிவ் திங்ஸாக உங்களுக்குள்ளே கொண்டு வாங்க. தென் கம்ஸ் மீ டைம். இது எத்தனை பேருக்கு தெரியும்னு தெரியல. மீ டைம்னு இப்போ நிறைய இடத்துல நீங்கள் படிச்சிருப்பீங்க. ஸோ இஃப் மெனி ஆர் ரீடிங் புக்ஸ்னா தே வுட் ஹவ் கம் அக்ராஸ் திஸ் டைம். ஸோ இட் இஸ் வெரி இம்பார்ட்டன்ட். நோ டிஸ்டர்பன்ஸ். ஹஸ்பண்ட், சில்ட்ரன்ஸோ, இன்லாஸ், பேரண்ட்ஸ் யாருக்குமே இங்கே இடம் கிடையாது. ஒன்லி யூ. அந்த மீ டைம் வந்து ஒரு நாளைக்கு குறைஞ்சது ஒரு ஹாஃப் அன் ஹவர் டு 1 hour உங்களுக்குள்ள ஸ்பெண்ட் பண்ணுங்க. லைக் யூ கேன் ஹாவ் கப் ஆஃப் டீ அண்ட் யூ கேன் ரீட் புக்ஸ். இல்லை உங்களுக்கு பிடிச்ச மாதிரி நீங்கள் வந்து ட்ரெஸ் பண்ணிக்கலாம். யூ கேன் டாக் டு யுவர் ஃப்ரெண்ட்ஸ், யூ கேன் டான்ஸ், யூ கேன் டூ வாட் எவர் யூ லைக் விச் மேக்ஸ் யூ ஹாப்பி. இட்ஸ் மீ டைம். ஸோ நீங்கள் மீ டைம் பண்ண என்ன ஆகும் அப்படின்னா, யூ கேன் நோ யுவர் ஸ்ட்ராங்கர் சைட். ஸோ மீ டைம், ஐ ரெக்வஸ்ட் எவ்ரி லேடிஸ் டு டூ மீ டைம். டைம் இல்லைன்னு மட்டும் சொல்லவே சொல்லாதீங்க. ஸோ வி ஹேவ் டைம் டு ஈட், வி ஹேவ் டைம் டு ட்ரிங்க், வி ஹேவ் டைம் டு பாத் அப்படின்றப்ப வந்து certainly we will have time for me time. So me time is highly essential for every woman. I request every woman to try for a me time to become a strong woman. So hereby I'm ending this session. If you have any doubts, you can contact me. I'm ready to help you. So this is how you can hack your happy chemicals. So to release dopamine, you can do self-care activities, and you can eat your favorite healthy food, celebrate your little wins, etc. For serotonin release, you can do meditation, yoga, or running, swimming, cycling. For oxytocin, you can play with a baby, hugging your family, playing with your family members. This is more available in this pandemic situation, so make use of it. Instead of fighting with each other, make use of it. Then end off in the painkillers. Love for exercise. It is a very easy exercise. Just switch on comedy channel and watch those comedy channels and laugh it loudly and burst your stress. so that all your stress level comes down. You will get rejuvenated and your mind will be focused. And thank you so much. Thank you. Any questions? Mrs. Kartika?
Ma'am.
Satish sir. Satish sir. Satish. Satish sir. Do we have any question sessions? Satish. Ma'am, Hema ma'am.
Yes?
The question is up, appearing on the screen, ma'am.
Yeah, okay. Yeah. So what can we make? How can we make bones to stronger after injury? The question is like, how can you strengthen the bone after injury? So it depends upon the level of injury, like what type of injury you have crossed, and what type of things you have come across, etc. Then we can make stretching or strengthening program related to that. You can always consult your therapist before starting any type of exercises. Since you say it is after injury, you must consult with therapist. Don't do exercise by yourself. It may end up in a pathetic situation. So please avoid doing by yourself. Yes, nice question. How can you overcome headaches? That's what I told you. You can have some deep breathing exercises. Just inhale through the nose and exhale through the mouth. Take a deep breath for 2 to 3 counts and just relax your eye muscles. Eye strain in eye muscles may lead to headache problem. So you can avoid, like you can do these type of exercise to overcome such headaches. And if you have persistent headaches, you should consult with the doctor. First have a try of these type of exercise so that you can check whether you can get relief or not. You can listen to mild music too. This will also help, and you can place aromatic oils around your room. The smell gives you nice release of hormones so that your headache, everything is will come down. So just give a try. I have put on weight after my C-section 1.5 years ago. How to bring back my ideal weight? Yes, I was about to tell body shaming, but due to time shortage, I couldn't tell it. So please don't worry, ma'am. You can you can regain your weight. Sorry, you can come back to your normal weight, but it takes some time. You need some sort of abdominal exercises and diet modification too. It can be normal as you were before. So it is possible. You can bring your ideal weight by following certain protocols, like certain exercises. Like I said, you can even dance. Give a try for dance, but don't stretch too much so that your stitches is getting painful. So please be cautious on that. Just have try a dance and limit your carbohydrate portion and increase your protein part in your food. Eat a balanced food, balanced and healthy food. You will certainly lose your weight. So don't feel for it. So don't. So body shame is entirely different. You should stay happy, fit, and healthy. It's not the figure we are appreciating here. So now many people are knowing about body shaming. So everyone is happy with the body what they have. But your question is like you have to be normal in order to maintain BMI. So you can certainly do that. Please follow what I said. At least 30 minutes per week, sorry, per day, you can do exercise, mild to moderate exercise, 5 times a day, sorry, 5 days per week, so that 5 into 3, 150 minutes. Aim for 150 minutes for a week, and you can get proper weight. Diet is also important here. So only exercise alone will not help you to gain your, regain your ideal weight. Diet is also important here. So please make a note of it.
Is there any questions?
No
Is there
questions,
any
ma'am.
questions? Okay,
No
shall we?
questions, ma'am. We
Shall
can
we?
end this meeting. Now we
Okay,
can
shall we
give
conclude it?
a vote of thanks.
Okay, thank you. Good morning to everybody. It's my privilege to propose vote of thanks in this grand occasion. First of all, I thank the Almighty for His blessings. Next, I extend my thanks to our college secretary, N. Tyagarajan, for his constant support for organizing this webinar on physical activity, immunity, and COVID 19. I would like to thank our beloved principal, Dr. M. Kannan, and Vice Principal, Dr. K. Krishan, for his invaluable guidance and constant support to organizing this webinar. I wish to express my hearty thanks to our chief guest, Dr. P. Hemalatha ma'am, woman wellness consultant and baby care, for her effective advice to improve the health and make this program a grand success. I also thank uh, our supporter organizing secretary, Dr. P. Minimala ma'am, of our Women Empowerment Cell, for taking effort to make this webinar in a grand success. I wish to express my thanks from the bottom of my heart to all the fellow participants for spending their valuable time with all and maintaining a discipline and decorum throughout the program. Next, I extend my thanks to the technician, Mr. Satishar, and my fellow teachers, beloved teachers who support me to organize the program in a grand success, Mrs. Karthika ma'am and Mrs. Malini ma'am. Okay, for to make this arrangement the program in a grand success. My special thanks to all who directly and indirectly involved in this program. Thank you so much, ma'am. Thank you for your well advised, ma'am, Hemlata, ma'am. Okay, next program we will going to the women shapeness and all. Okay, I hope so. We will do it. Thank you so much.
Sure, ma'am, sure. Thank you so much for inviting me here. Thank you.
Thank you.